Thank you. Are there any questions from the committee? All right, thank you so much. We're now going to continue with House 2213 and Senate 1404, an act relative to acute hospital governance. And we have a panel with Silda Melo and Myra Cacace. Cacace. Cacace.
Italian.
Davvero. You can continue.
Good morning, chairs and committee members. My name is Silda Melo. I am a registered nurse, registered voter, and the president of the American Nurses Association, Massachusetts. Thank you for this opportunity to provide testimony in support of House 2213 and Senate 1404, an act relative to acute hospital governance. I'd also like to express our gratitude to Senator Lovely and Representative Khan for submitting this bill. ANA Massachusetts is the state representative organization of the American Nurses Association, which is the oldest professional organization for nurses and advanced practice nurses. ANA Mass is the largest voluntary member organization advocating on behalf of nurses in all nursing settings. ANA Massachusetts submitted this bill to mandate the establishment of at least one registered nurse member with full voting rights and privileges on the board of directors or trustees, the board, of all acute care facilities in the Commonwealth. A nurse on the hospital board will ensure that the chief executive and hospital leaders will benefit from the insights, knowledge, and experience of the largest working group in the healthcare arena they serve. We urge you to pass this bill because nurses are the backbone of the healthcare workforce. There are more nurses in the healthcare workforce than any other professional group, and Gallup polls consistently rate nurses as the most trustworthy profession with the highest ethical rating. Today's nurses have the significant expertise in the areas of quality improvement, patient safety, and healthcare administration. We fiercely advocate for the physical, psychological, and spiritual health needs of patients and their families. And nurses know how to create a work environment that leads to higher retention rates for staff nurses, which is especially important right now during the current nursing shortage. I'll hand it off to my colleague Myra Cacace for additional considerations.
So hi, I'm Myra Cacace. I'm a registered nurse practitioner, a registered voter, and a past president of ANA Massachusetts. I'm also the co-chair of the Health Policy Committee because I can't get enough of this stuff. I've had countless discussions with my husband, George, who has worked in industry for over 45 years. He's worked with several companies in Europe, and he says that in Europe, there is at least one member of the workforce on the hospital decision-making board or on the industry decision-making board. So he asked me the obvious question, why, since nurses are the largest segment of the healthcare workforce, are they not a member of the hospital decision-making board? So I started my research, and I've included some articles with our written testimony, but I wanted to highlight one that from Jaeger, Schofer, and Heining in Germany, which has included workers on their corporate boards for over 70 years. And their research showed that workers being given a greater voice in the management of the workplace leads to positive outcomes for the company and like increased satisfaction and retention of their workers. In the United States, nurses on boards is not a new concept. The Nurse on Boards Coalition was developed in 2014 in answer to recommendations made by the 2010 Institute of Medicine report, which encouraged adding nurses to hospital boards to ensure quality of health and safety in the community. There have also been other legislative initiatives requiring worker representative on corporate boards. One such initiative is the Accountable Capitalism Act proposed by Massachusetts Senator Elizabeth Warren in 2018-2019, which mandated that 40% of the board seats be elected by employees. The Joint Commission on Accreditation is also in favor of engaging healthcare leaders and their board members and to include healthcare nurses on the boards. Silda?
Thanks, Myra. As nurses, we are on the front lines in developing strategies for excellence in quality care, patient safety, positively affecting the bottom line while promoting high quality, evidence-based, and culturally competent care. Lastly, and most importantly, nurses are bound to a code of ethics, perhaps unlike other board members, to put patients and communities first and to promote and advocate for and protect the rights, health, and safety of patients. Yet most hospitals in the Commonwealth do not have a nurse on their board. Let's change that together. Thank you for considering this bill. Additionally, ANAMASS will also be submitting written testimony in support of House 2212, an act creating a nursing advisory board, and Senate 1377, an act relative to the healthcare workforce. And we have previously submitted testimony in support of Senate 1436, an act relative to safe patient handling and mobility in certain health facilities, which you've heard of before today. Thank you.
Thank you so much. Any questions from the committee?
Okay.
Appreciate your time.
Okay.
Still this morning, which